Have you been thinking about hairline lowering and not sure who to choose and aren't sure what to expect from your results? I'm Dr. Sarah Saxon. I do a lot of hairline lowering and my technique has changed fairly dramatically over the last 6 months. What is a hairline lowering procedure? Hairline lowering is where we make an incision right in the hairline to advance the scalp forward so that your forehead isn't as tall. It's an alternative to hair grafts that allows the hair to be more thick, more dense, and I think has better results versus hair grafts. What I've found over the course of the years that I've been doing this procedure is a couple of structures keep you from advancing the scalp forward. I've modified my technique really over the last couple of years to accommodate for that. And the structures that I'm talking about include the temporalis fascia. So there's a layer, a thin translucent layer called a fascia overlying the muscle called the temporalis muscle here. It's strongly adherent to the skull and is just underneath the skin. What I found is that temporalis fascia really holds down the scalp in the front as well as holds the eyebrows down. Another structure that holds the scalp into the position that it's in is the coronal suture line. So you have a junction between two pieces of your skull right in the middle going all the way across called the coronal suture. In that area, the fascia in your scalp is strongly adherent to the bone and is thicker there. And the last structure that I find holds the scalp back is that it's a layer of scalp itself that's really thick and doesn't stretch a lot. So addressing all of these three areas is what I find helps me get a better advancement and a better overall outcome. So what do I do to handle all these areas? So with the temporalis fascia, I want to lift up that attachment of the fascia from the bone. And some surgeons go in a layer just on top of the muscle, which is what I do. It has the least incidence of having nerve injury to the temporal branch of the facial nerve. The temporal branch of the facial nerve travels right here, and it actually controls your forehead. So if there's damage to that nerve, then you may have a brow droop on that side. Studies that were done by Dr. Jeff Spiegel, who I trained with, show that if you go deep to the deep layer of the temporal fascia, just right along the muscle, you don't have any risk of damage to that nerve. Now, some surgeons go superficial to that, where you have a small but not zero chance of damage to the nerve. I go in that area and lift the whole attachment of that fascia up. Now, the other thing that I do now that I didn't used to do is lift up the skin right through that coronal suture line. That's where the fascia is very thick and adherent to the bone. If I release that up here, then I'm able to bring the scalp more forward. That sounds very scary, but it's just a few centimeters of skin that I just lift up, and I'm able to get a lot less tension on the incision. When it comes to the Galea aponeurotica, or I just say Galea, different surgeons address that differently. Some surgeons make little cuts in the Galea called Galottoies. Some people don't like to do that because they say it causes some hair loss. And I'm in the camp of Galottoies really help. If you don't go too deep with those incisions, they don't affect the hair follicles. Now, I have over time adjusted how I do Galottoies. And this is something that came to me probably about 6 months ago, where I thought about it like almost like when we do skin grafting for burn victims or someone who's having reconstructive surgery, we often will take a skin graft using a dermatome, which is a device that kind of shaves off just a thin layer of skin. But we don't want to take a bigger skin graft than what is necessary to cover a given area. So what we do with a skin graft is put it through a mesh. And what that does is cut tiny little holes in the skin graft so that it expands. So it can cover a much larger area than a solid skin graft can. So I think of doing my Galottoies sort of like that. If you make these tiny cuts, many tiny little cuts in the galea, and in going in different directions depending on what direction you're wanting the scalp to move, it will actually expand far beyond where it was before. And couple things that these 3 techniques do is take tension off the incision and allow me to advance the scalp forward a whole lot more. Things that I do now used to take 2 stages of surgery before, and I often will be surprised at how far I can advance the scalp, because I'm not only advancing it forward, I'm also rotating the sides inward to keep the hairline rounded off. All surgeons modify their technique over time, but I really find that these 3 maneuvers that I started to do, and almost everyone has provided me the opportunity to really give dramatic results where I may have not been able to do before. So if you're considering hairline lowering surgery, the technique that your surgeon uses is very different depending on who you go to. If you don't have much distance to cover, if you just want a slightly lowering or even straightening of the hairline, doing a procedure that's less aggressive is probably okay for you. But if you're wanting a dramatic advancement and you're going to a surgeon that says they can do it under local anesthesia and they don't elevate all these areas, it's likely that you will be left doing another procedure down the line to get more advancement, or having to go back in later to do hair grafts to lower the hairline even more. So I hope this was really helpful for you. I am here for any questions that you might have. Just leave a comment below, and I answer all those questions myself. So if you will help me out and like this video and subscribe to my channel, I'll be continually putting more and more helpful information that will guide you through the process of hairline lowering.